so I can put questions in the chat.
Yes.
What are you?
To make it bigger. Wait, they.
Welcome to Zoom. Enter your meeting ID followed by pound.
Just hear the F word.
Yes. Good afternoon, everyone.
Good afternoon, Dr. Chesson.
Good afternoon.
Hello.
Good afternoon, everyone. Welcome to today's Early Childhood Provider Update webinar. We are so happy to see so many folks on today's call. Our numbers are climbing. So just wanted to begin by saying welcome. Please remember to mute yourself during today's webinar. I am Jenna Chasson. I'm the Assistant Superintendent for the Office of Teaching and Learning. And we are so happy to have you all on today's call. We will be sharing some very important provider updates throughout today. So welcome. We'll proceed to our agenda. And today on the call, we will be talking about give us one moment. I think we're having some technical difficulties with our sound.
Sound is off, but everything.
Just, I took out, okay, we're just checking sound. Is it more clear now?
Once again, sound check. Can y'all hear me?
Jenna, your sound is still robotic. We're getting the robot voice, but when Lisa unmuted herself, it was fine.
All right, everyone. Thank you so much for your patience. I have obviously switched to Lisa's computer. My computer seems to be giving me some issues on the Zoom, so hopefully everyone can hear me now. So welcome to our early childhood provider update webinar this afternoon. We obviously have a lot of really important updates in light of what is happening right now in our state. And we also have some exciting updates around some of our stimulus funding and the upcoming ARPA stabilization grants, as well as our teacher support grant guidance. After the department presents some information today, we are very, very thankful to have Teresa Sokol, a state epidemiologist from the Department of Health, with us today. And so just a reminder, as usual, we will be open to answering questions in the chat. So throughout today's call, please go ahead and enter any of your questions in the chat, and we will pause at the end and answer any of those questions that came in. So thank you all again for joining. I will turn it over to Lisa Brochard, and Lisa, as many of you know, is our Deputy Assistant Superintendent of Early Childhood Operations. And Lisa will lead us through some of our important information about updated guidelines, as well as our ARPA stimulus grant application.
Okay, good afternoon, everyone. Thank you all for joining. So just really quick, as far as the COVID-19 resources, one of the things I wanted to just remind everyone is that we just recently, as of yesterday, I think it was the date that we updated in conjunction with Office of Public Health, the guidelines for childcare. And I know Teresa will probably highlight some of these things as she's talking this afternoon, but the highlights of the changes are in relation to the governor's mask mandate. And so just to reiterate a few things is that staff and children 5 years and older must wear a mask indoors, regardless of their vaccination status. And this includes within transportation or transporting children. It is strongly recommended that children between the ages of 2 and 5 wear a mask. Of course, masks should not be worn while sleeping. And then if you look at where children should be screened, there's some tweaks on some of the the items you should be looking for when you're screening children prior to their entry into your center. So those are the highlights of the changes there. So if we can go to the next slide. Okay, so we're going to talk today about the ARPA stabilization grants. And so we are pleased to announce that today we will open up the ARPA grant application, and it will be open for 2 weeks. And just to take a step back about what this is, back in the spring, Congress and the President passed the American Recovery Plan Act. Louisiana is receiving about $475 million in child care stabilization funds. And we are going to be issuing 2 rounds of ARPA stabilization grants for providers. Providers who will be eligible include type 1, type 2, and type 3 licensed early learning centers, as well as CCAP certified homes and family homes. At this point, Head Starts are not eligible for this particular grant. We do have some Head Starts that receive some before and after CCAP kids, which we will address at a later date. So we can go to the next slide. Okay, a couple of things that I want to talk to you about as far as the application process is that this application is a little bit more in depth than the application for the LCAP grants. It's going to serve two purposes. One, of course, is the regular grant for an application with some additional information that the federal government is requiring us to ask and that we'll have to report on. The second reason is that we're going to use this opportunity to do what's called a narrow cost analysis to reassess our CCAP reimbursement rates. We know that the rates that we pay do not the true cost of care. They do not cover the true cost of care. So we want to use this opportunity to gather the information that we need to really, really dig into the true cost of care and then reassess those rates, which may increase. Again, this application is a little bit more lengthy than the LCAP applications. And I do want you to pay special attention to the certification statements as they are different than the LCAP grant certification statements. So please pay attention to those certification statements. We have developed a worksheet that will help providers gather necessary information for the grant application. We're going to send that out later on this afternoon, along with a link to the grant application, so you will have it. We highly recommend that you use this worksheet prior to filling out the application, because I think it will help you tremendously. You may have to, for some of the questions, contact your bookkeeper and things of that nature for some of your expense information. We can go out to the next slide. So what I want to do today is go through the formula for this application, because again, this one is different than the CAP application, because the feds have put in different requirements in this funding source. And so what I'm going to go through today with you is how we calculated the base amount and then the bonus amount, or what the base amount is and what the bonus amount is and how it's calculated. The base amount is still based on license capacity. So it's about, and then there's a bonus amount. So it's about a 2/3 to a 1/3 split, meaning that the majority of the money is based on license capacity. So you'll see it's $1,256 per child in license capacity. And then there's a bonus amount of $628 per child in license capacity, which will depend on a few things, a few categories or bonus amounts that we're going to talk about in just a minute. And I will dig deeper into how we calculated the bonus amounts. And if you bear with me until I can get to the end. When I go through an example with you, it will make a whole lot more sense as I go through an example. So just to give you a high level, look at what the calculation would look like. So if your license capacity is 100 children, so 1256 times 100 children would be $125,600. If you qualify for all the bonus amounts, it would be $628 times 100 children, which would be $62,800, or a total of $188,400. So just keep those two figures in mind, the 1256 and the 628. Now, the next slide, I'm going to go into a little bit deeper into the bonus calculations. So we talked with multiple stakeholders and also with the feds, and they are really pushing us to look at this money in a way that that really has an effect on areas of need in our state. So we're looking at three areas. We're looking at the site, what type of site it is, what services are provided by that type, and also the community. Is the community more at risk and things of that nature. So you'll see the appropriate percentages that are listed there. So you've got community, which is based on what we call a social vulnerability index, and I'll talk a little bit about that later, and that's 20%. The site, depending on the provider type, whether it's a type 3 or a family home or in-home, it's 10%. The percent of certified CCAP kids in reference to license capacity is 20%. And then the services that are provided by your center. If you provide transportation, not including field trips, but transportation to before and after to have a full day of service. If you provide infant care according to your license, if you provide toddler care according to your license, if you offer care to special needs children or offer care to children who English is their second language. And then also if you offer non-traditional hours, all of those parts play a part into the bonus. So we're going to dig in a little bit deeper. We can go to the next slide. So looking at the site categories, this provides you a little bit more description. So percent of CCAP certified kids. So providers can receive up to 20% of the bonus amount based on the percentage of CCAP children they serve proportionate to their license capacity. So you'll see if someone has 27% of their license capacity is CCAP children, then their percent is 16% of that bonus. Provider type, if it's a family home or in-home, it's 8%, and type 3 is 10%. And if we can go on to the next one. Now, looking at the services provided, offering non-traditional hours is 10%, offering transportation, again, not field trips, is 5%, serves infants and toddlers is 15% each, serves children with special needs is 5%, and then serving children who speak English as a second language is 5%. Let's go to the next slide. We'll look at the community factors. Like I was saying, the providers can receive up to 20% of the bonus based on their social vulnerability index. This SVI was developed by the Centers for Disease Control, and it's used to identify social vulnerable communities. It takes into account things like socioeconomic status, household composition, minority status, language, housing type, and transportation area. And it's divided by census tract. The census tract is the smallest geographical area, for lack of a better word, that you can get. And there are certain indexes that are assigned to those census tracts. We map basically zip code of your center to those census tracts, and that's how we come up with the index. So that's how we match it to the index that the CDC has determined. In some instances, there are several zip codes attached, or there's one zip code actually attached to several census tracts, and they all have different indexes. We chose the highest index because the higher index, the higher of the percentage of the bonus that you would receive. So let's dig a little bit deeper into SVI. You'll see there it is based on 4 large buckets, for lack of a better word. Again, socioeconomic status, household composition and disability, minority status and language, and housing type and transportation. And this is a way that we can help with distributing the money where the money is needed the most. It helps to put some of these funds where families can least afford it. And that's why we're using the SVI index. Now, let's go in. I think there's a question real quick about the census tract. The census tract is based on on the zip code of the provider. So it is where the provider, the location of the provider. It's a good question. So let's dive into the calculations, because I think a lot of this will make a lot more sense once we go into what the calculation looks like. So you remember the example I had earlier about 100 children in licensed capacity, and if the full bonus amount is $628. So let's go into the next slide. So again, base amount is $1256 per child in licensed capacity, again, which is $125,600. So that is the base amount. So everything else that we're going to talk about is the bonuses. So this particular site has an SVI index of 0.26. Again, it's based on the zip code of the provider. This provider at 0.26 gets 16%. So 628 times 100 kids in licensed capacity times 16% gives the $10,048. We can go to the next slide. Now we're looking at the site factors. This particular site for this example is a type 3, so they get 10%. And this provider provides between 11 and 25% of their licensed capacity as CCAP children. So you'll see the appropriate calculations there. Type 3 is 10%, and then CCAP children is the 14%. So it's an additional, a little over $14,000 added there. And let's go to the next factor. And let's look at, this is the services that this particular provider offers. They offer infant care, they offer toddler care, and special needs care. They do not operate non-traditional hours, they do not provide transportation, and they do not serve children with English as their second language. So serving infants adds the 15%, serving toddlers adds the 15%, and then serves children, special needs children is the 5%. So when you add up the base along with all of the bonuses, this particular provider would get $172,700. I think we added in the link to the formula or to the worksheet. Perfect. We just added into the chat because we don't expect you to do these calculations by any means whatsoever and want to provide you some help in looking at it in advance of completing your application. So in the link, we have linked the application and we've linked the worksheet. And within that worksheet is a link to a calculator that you can use. It just asks you, simple questions that will calculate your estimated grant amount as well. So let's go on to the next slide. Okay. So we want to just go through some dates with you really quick. So again, August 5th, which is today, we're opening up the grant application. It closes on August 19th. Normally we give a 1-week turnaround for applications, but being that this application is a little bit more in depth and asking for a little bit more information, we're going to give a 2-week turnaround period. Again, we're going to be very strict on the deadlines for this application. This is a large amount of money that is going out. This particular round of funding, we're estimating as a total will be close to $200 million that is going out. So overall, because of that, we are going to be, when we're issuing the grant funds itself, we're going to be doing it on a rolling basis. So you'll see on September 13th, the funds will be going out to Orleans, Thibodeau, and the Shreveport area. The week of September 20th, it'll go to Lafayette, Baton Rouge, and Monroe area. And then on the week of September 20th, the money will be going out to the Covington, Lake Charles, Alexandria area. We will offer 4 rounds of office hours related to the grant. Everyone knows Melinda, George, and her team. They're a wonderful team. And so they will be available if you have any questions on the application. You can get on in these office hours and ask questions. If you're not sure which box to check, you have a question on expenses, on what's allowable, things of that nature, they will be able to answer those questions for you. So these are all within, before the time period of the actual due date. You will see below there as well that you can contact the provider help desk as always through their email address and also the phone numbers listed there. In the office hours, you'll see a link to the Zoom meetings as well, and we'll send that out as well this afternoon, along with the worksheet as well as the grant application. Okay, we'll go to the next slide. Can we go back one more? There we go. So just to sum up really quick, as a reminder, again, there's a link to the estimation calculator that you can use, and then office hours. I will say when you go through the application, they're going to be, and you'll see it in the worksheet itself, you'll see an area, or in the application, you'll see an area where we're asking for monthly expenses. And then you'll see an area where after it calculates your grant award amount or your estimated grant award amount, it's going to ask you very similar information, but we need to know how you anticipate spending that money. We're not going to hold you to it by any means whatsoever. You can change it around, but the feds are asking us how providers anticipate spending that money. So just don't get confused on those two. So I think there's a question about, are we only looking at funding from CCAP, about funding for NSCCD and birth to 3? This money is strictly for childcare. It is not intended for NSCCD or birth to 3. I think we will be looking at some potential for where there's diverse delivery for LA4 and things of that nature, where they can offer a full day of service that, within childcare that we can assist with. But this particular grant is not for that. You want me to answer any questions now, or should we wait till then? Any other questions now? Okay, and I think there's a question about the website and what sort of question, where do you put in the zip code? You will see it's going to be pretty obvious in the grant application itself, and also in the calculator. And to calculate it correctly, you're going to put in your physical, your physical address, but then it's going to ask you to verify your zip code. It's very important that you verify that zip code and push the appropriate button, because that is what does the calculations all magical behind the scenes. So I'm gonna hang tight for 1 second and I'm gonna see if there's any other questions, and I'll be right back.
They're looking at their. That's what it is. That's what.
So just a couple of questions that I want to answer. If you are confused about the regions as far as the payouts, contact the provider help desk and they can answer, your particular area and where you fall within those 3 blocks. I think there's a couple other questions about, can smaller centers apply for the grant? Yes, if it's a type 1, type 2, or type 3 center, yes, they can apply for the grant. Can this money be used for expanding a center? This money cannot be used, as with any sort of CCDF money, cannot be used for any sort of major renovations. Will the second round in 2022 be similar? We anticipate it's going to be similar. I can't make any promises yet. We're going to look at, we really kind of want to see what sort of difference it's made between, between round 1 and round 2. So if we see, improvements in who offers, infant care and things of that nature, we may put a higher percentage on that and things of that nature. If we happen to not have as many people apply as normal, then that will leave some money that we may, money on the table, for lack of a better word, and we'll tweak it from there. But, I think you can pretty much count this as a minimum for the most part, at least for the base amount. I'm gonna hang tight for 1 minute and I'm gonna see if there's any other questions. If you can leave. Okay. Could we use this for updating our centers? Again, you cannot use it for, for major renovations. It just depends on, if it's COVID related and things of that nature. So if you can contact the provider help desk with your specific situation, they can walk you through that. Will childcare centers that are part of NACCD be eligible? Childcare centers that are licensed are eligible. The special needs include children with IEPs or speech therapy. Yes, IEPs, IFSPs, any children with special needs, even if they don't have an IEP, but they have any other sort of special needs, we would include that as serving kids. Let's see, does this apply to type 1 centers that do not provide CCAP? Yes, it does. I think there was a question about 0 to 3 care. Again, this is, and I'm not sure I quite understand the question, but this is for type 1s, type 2s, and type 3s. It is, again, not for NSCCD or LA4. We're going to handle that, have classes in a childcare center. We will handle that in a separate allocation. What was the status of the last round of applications that were applied for? Those were distributed. If for some reason you did not, you applied and you did not get your payments, please contact the provider help desk and they will walk you through that. Is this round 3 grant or is this a whole separate grant? This is a whole separate grant because the funding source is totally different. And we have to ask different questions for this one. Will you be going over what the funds can and cannot be used for? In the application itself, you will see some good descriptions of what the funds can be used for. So I think it's in the worksheet as well as in the grant application. So I would go by that. Will you be using zip +4 or just the zip code? It's just the zip code. Montessori schools that are type 1, if you're type 1, you are eligible. Can you give us some examples of how the grants are supposed to be spent? Again, in the worksheet and the application, it describes how the monies can be spent. And, anecdotally, what I've heard from most providers is that they're using this for personnel costs. And what I tell people if they need to do renovations and things like that is to use, use this money what it's intended for. Use it for personnel costs, use it for insurance, use it for rent. Then take that money you would have normally put towards that and use that money for your renovation costs. Can family childcare providers apply for the grant? Yes, they can. The CCAP family childcare providers can. Is there a time limit to spending these funds? As of now, there's not. There's a little bit of I don't want to say confusion, but from the feds as far as the end of the sub-grant period, and so I'm trying to get some clarification on the feds right now. But I would think you would be able to spend this money, in the time period needed. This is intended to be a stabilization grant. It's intended to keep you open, basically. So it's based on licensed capacity and not CCAP students. It's actually based on both. The base amount is based on licensed capacity, and then the CCAP students plays a part into the bonus. Okay. And we're going to go ahead and continue to put in your questions, and we will take those questions and add them to the FAQs. I think we're going to take this moment to talk more about teacher support grants and then turn it over to Teresa.
Thanks, everyone. We will move on, and thank you, Lisa, for presenting that in such a clear way. I know we might have some lingering questions, but please know that some of this is clarified through the application process, and then Lisa shared earlier how you can continue to have your questions answered. So remember that we are here to support you. We have a whole team here to support you and answer your questions and help you through the ARPA grant. So we will move on a little to talking about our teacher support grant, which was previously released and a lot of you all applied for. And so we released an application for round 1 of a teacher support grant in July. Unique Louisiana data show that rates of teacher turnover are very high for early childhood educators, with 40% of childcare teachers leaving their site each year. And that's really the purpose and the frame of this teacher support grant that was offered. And moreover, just 1/3 of teachers observed in Louisiana's publicly funded early childhood classrooms are still there just 3 years later. And so this teacher support grant is specifically designed and intended to support teacher recruitment and retention. And so we just had a little further information today that we wanted to make sure to share with you all around these teacher support grants. The amount and timing of the funds given to teachers and support staff is completely at the discretion of the owner and director. All teachers and support staff still in employment at the center should receive a stipend, bonus, or wage supplement from this grant. This includes both lead teachers and assistant teachers. It could also be used on non-instructional support staff like your bus drivers, your cooks. Directors who are solely administrative staff and do not provide direct support or instruction are not eligible to receive these grant funds. And directors may choose to provide different levels of payment to individual staff based on the staff longevity, the work hours, or other factors. So again, that is at the discretion of the director. We also wanted to make sure that you all knew that providers need to retain documentation of expenditures related to the teacher support grant. This could include records of stipends, bonuses, or wage supplements issued to staff members, check stubs, documentation of how amounts were determined for staff, and bank records showing the payments issued. All of this documentation needs to be available for us at the department upon request for auditing purposes. And you should expect an audit after funds are spent. So we thought it was really important to bring some information to you all today about what is called the benefits cliff. And a benefits cliff happens when household earnings increase just enough to result in an abrupt reduction or loss of critical social service benefits. This is very disruptive for families because earnings usually have not increased enough for self-sufficiency without the benefits. The purpose of these grants is to help teachers, not harm, and help providers stabilize the childcare workforce. And there may be some unintended consequences depending on how providers choose to pay out these grants that we wanted to make sure to flag for you all today. For example, at the department, we have heard sometimes of examples of families who qualify for CCAP and whose employers have offered them raises of $1, $2, or $3 an hour in recognition of those employees' great work. Unfortunately, however, sometimes that offered raise would make that family no longer eligible for CCAP benefits, but also unable to afford to pay the full tuition rate for their childcare on their own. In such a case, the families have had to turn down the raise, though very much needed, or have them lose the job when they had to stay home with the child because they could no longer afford childcare. Many of our workers in the childcare industry, like many of our families, live just on the technical brink of poverty and cannot afford to work for these jobs without some of these critical assistance services. So we wanted to make sure we were bringing you all that information and flagging it for you today. And so what public benefits may be at risk? You have some here listed on your screen. And your staff, when receiving this teacher grant, teacher support grant, may be at risk for losing some of these critically needed benefits if their pay then goes over the threshold for some of these services. Sites can take several steps to ensure that efforts to improve staff wages have the greatest possible impact on your employees' well-being. So one thing is to make yourself more knowledgeable about this, know the annual wage that you provide to your employees' household size, and how it relates to that federal poverty level and social services eligibility. You could also consider providing short-term increases in wages or increases to lower wages, or one-time or periodic bonuses instead of hourly wages, and also provide sufficient wage supplements and raises to cover the cost of any lost public aid. The department encourages that sites not necessarily just make a one-size-fit-all. Consider providing your wage enhancements in different ways if staff have different needs. Again, these funds can go out to your teachers based on criteria and a timeline that is at the owner director's discretion. So make sure to give your teachers voice, listen to what their needs are and how you might best help to support them. We will be offering some further clarification around the teacher support grant and this issue of the benefits cliff, and some additional guidance. So you can look for that upcoming in our next newsletter about some opportunities that we'll have for you all to hop on to some office hours and talk with some experts around the benefits cliff and what this means for you and how you allocate that teacher support grant to your employees. So I wanted to highlight a few upcoming events before we turn it over to Teresa Sokol from LPH. So just a reminder of some key dates. Lisa talked today about the ARPA stabilization grant round 1 application release that is happening on August 5th, which is today. On August 9th and 12th next week. And then again on August 17th and 19th, we will host office hours. Again, office hours available to provide additional information, but also to answer any questions that you all might have. August 19th is going to be when round 1 of the ARPA stabilization grant application will close. And on September 1st, type 3 providers can begin receiving up to 2 hours of free tax consultations from tax professionals. So please monitor our newsletter for how you can register and sign up for that September 1st event. And on September 30th, all early learning staff on the premises of a center and accessible to children should have current certification in CPR for infant, child, and adult, as well as first aid. And our next webinar is going to be next month on Thursday, September 2nd at 1 p.m. The information and the Zoom link are available here on this slide. Sharing once again our contact information. And it is now my pleasure to introduce Teresa Sokol from the Louisiana Department of Health, a state epidemiologist who will speak to you all today about what is happening in our state with COVID-19 and provide some updates for providers. Teresa, thanks so much for being on with us today.
Hi, can y'all hear me now?
Yes, we
Yes, we can hear
can.
Okay, good. Thank you so much, Jenna, and thanks, Lisa, for inviting me to be here. I'm going to try to share my screen. So I'm going to go quickly. Just let me know if you can see that title slide.
We sure can.
Okay, great. So today, and thank you so much for allowing me to be here. I'm just going to give you a little bit of an update about the current state of COVID in Louisiana. Unfortunately, I don't have very good news to bring right now for the most part, but I want to talk a little bit about what's happening, a little bit about what has prompted some of the recent changes to our recommendations, and a little bit about why vaccination continues to be such an important effort for really for all Louisianans that are eligible. So the first, okay, so this slide is a little bit busy, but because it's got a lot of information on it. So I'm just going to kind of go through piece by piece and show you, because really these are some really important indicators related to transmission and also related to how sick people are getting here in Louisiana. So here at the top, this graph at the top left-hand side, this is really looking at emergency department visits. And what it's telling us is the percentage of people who are going to the emergency department, percentage of those people that are going there because they have COVID-like symptoms. And what you see here, this part right here, this last red part, that is where we are now. And that is almost 14%. So that means that almost 14% of all the people that are going to the emergency department right now are going because they have COVID-like symptoms. And you can see what's so important to note is that this is higher than it's ever been at any point in our pandemic. As everyone knows, this is our fourth surge. You can see the previous surges there, and we are considerably higher than even our highest point in the previous surges. So it's really concerning because it's really taxing our emergency department. And it also means that a lot of people are sick. Some of these folks will go to the ED and they're able to be discharged, but a lot of them have illness that is so severe they have to be admitted. This second graph here, just to the right, the one that's got the red and the green in it, that's showing new cases over time. It's the new cases per 100,000 Louisiana residents over time. And you can see really the same trend is true. You see such a steep increase in cases. Most recently, it's really started sort of end of June, beginning of July. And we are at a higher point in the pandemic for new cases than we ever have been before. Again, it's very concerning. What that's telling us is there's just so much transmission that's occurring throughout the state. And I'll show you a map later that really kind of highlights that. If you look down at this graph that is in the bottom left-hand corner, this has two pieces of information. This purple line is showing test volume over time. It's really just showing you how many people are getting tested. And the orange bars are showing the percent of those tests that are positive. So you can see here, so many more people are getting tested, but also the percent of those people that are testing positive is increasing. And when both of those pieces are increasing at the same time, it tells you that there is an incredible amount of transmission that's occurring. Because even though you're testing more and more people, more and more of those people are testing positive. And so if you look at these two pieces together, the incidence, the red and green graph, and then this percent positivity and test volume graph, that really tells you that honestly, we have a level of transmission right now for COVID-19 that has not previously been seen in our state. It really and truly is widespread, uncontrolled transmission. And unfortunately, what that leads to is what's highlighted in the next graph, the one with the blue and the orange line, just on the bottom right-hand side. And these are hospitalizations. These are the number of people each day that are hospitalized in Louisiana as a result of COVID. And what this is not showing, because I pulled this graph a couple of days ago, is that we are also at an all-time high for hospitalizations. And I know that you all have probably seen a lot on the news that our hospitals are just filling up. And it's a problem for people, obviously for people who are sick with COVID, but even people who need hospital treatment who for other conditions as well, because it's taking so many of the resources in our hospital. And unfortunately, oftentimes what happens is we don't really start to see increases in COVID-associated deaths until after we see some of these other increases, because it takes a longer amount of time for us to get the information. It's a longer reporting period, and often people might be sick for a long period of time. But this is what we're starting to see right now. We are starting to see an increase in the number of people that are dying from COVID, and honestly, it is increasing very rapidly. Just like all of those other indicators, it is a steep increase. And I'll tell you, the sharpest increase that we're actually seeing are among individuals who are younger than 40 years of age. It still is a smaller proportion than some of the older age groups overall, but that is where we're seeing the sharpest increase. Most recently, we had approximately a 600% increase in the deaths that occurred in people under 40 if you compare people who died from COVID in June and the people who died in July. Is an enormous increase in younger age groups. This was the map that I was talking about. And this map shows what the level of community risk is by each parish. And really what it tells you, it looks at some of those other indicators that I mentioned, the new cases and the percent positivity, and it can tell you, and usually we will see lots of differences in different parishes. So somebody can go and see what's really happening in their parish. What it's telling us now is that every single parish in Louisiana is at the highest risk for community transmission. And so it's a concern. You probably had seen some of the national coverage as well. Louisiana right now has a higher rate of transmission than any other state in the United States. This is not, these are COVID cases by age group, but it is not for those under 30. I just wanted to highlight the cases actually overall here. What we tend to see pretty much in every surge are, you see this gray line here? Those are 18 to 29-year-olds. They're young adults. And they typically, they tend to be the highest number of cases, responsible for the highest number of cases that we see overall. It was true in every surge, it's been true in every surge with the exception of the very first one. And it's true now. You can see here, most recently, they are the highest, they're the group that is responsible for the highest number of cases. But here's the difference. What you see is this orange line here. Those are kids under 18. And what is different is that you can see in previous surges, they have accounted for fewer cases than most of the other age groups. But now they are close behind those 18 to 29-year-olds. We are seeing more transmission in the pediatric population than we have ever seen before. And a lot of the reason that we're seeing such incredible transmission is because of the Delta variant. I'm sure you've all heard of it. There's been a lot of news coverage. It is the predominant SARS-CoV-2 strain that is circulating both in Louisiana and throughout the US and throughout many other countries at the present time. It's responsible for between 90 and 95% really of all COVID cases that we have in Louisiana. So anyone who gets COVID right now, chances are it's the Delta variant. And the Delta variant is a big problem. One of the main reasons is that Delta is extremely highly transmissible. It's at least 2 times more transmissible. It's easier to spread from one person to another than previously circulating strains in Louisiana and in the US. And what that means is, I know a lot of people have heard about what are called vaccine breakthrough infections. And really, a lot of people have been surprised about that, about the vaccine breakthrough infections that we're seeing and that we're reporting. And the reason is the vaccines are so effective that I think a lot of people thought that no one who had been vaccinated would be able to be infected. And then that's just not true. And it was actually never expected to be the case. But the problem is when we have high levels of infection, more and more individuals are going to be exposed. And so there are going to be more infections among both unvaccinated and fully vaccinated individuals. Keep in mind that those who are fully vaccinated are at much lower risk of being infected, but it does happen. Usually they have much milder symptoms than people who are not vaccinated. And the vaccines are still extremely highly effective at preventing severe illness, especially hospitalizations and deaths. I will say this though, we do sometimes see hospitalizations and deaths among individuals who are fully vaccinated. Those individuals tend to be people who are quite a bit older and also those who have some severe underlying medical conditions. And what we're learning is these individuals who still do have these severe outcomes that are fully vaccinated are ones that might be more likely to have not had a good response to the vaccine because of their age, of their advanced age, or because of the other medical conditions that they may have. So here's this last bullet really is the other key piece of information that, that is really different about Delta than the other strains that have been circulating. And that is that fully vaccinated people who are infected with the Delta variant can spread the virus more easily than fully vaccinated people who were infected with previous strains. I think everybody knows that a few months ago, CDC came out with guidance that said fully vaccinated individuals don't need to quarantine if they are exposed. They don't need to wear a mask indoors, and they don't need to quarantine if they don't need to get tested after exposure. And the reason that CDC put out those recommendations is because they gathered a lot of data and they actually tested people, right? And so they tested people who were fully vaccinated and were infected, but not with Delta, with previous strains. And what they found was that the amount of virus circulating in their bodies was so low that even if they were infected, they were at such low risk of transmitting it to other people. And that's just not true for Delta. What we're seeing from the data now is that people who are infected with Delta, regardless of whether or not they're vaccinated, they're still at increased risk for transmission. They're still about equally likely to transmit, to spread the infection to others. Keep in mind, like I said, fully vaccinated folks are much less likely to be severely ill. They're much more protected from infection and especially from severe illness. But when they do get infected, they can spread it. And so that's why we had to change some of our public health recommendations. So a few weeks ago, LDH recommended that everyone wear a mask indoors, regardless of vaccination status, because of some of this new information that we're learning about Delta. Now, as everyone knows, as of yesterday, this recommendation is a mask mandate by order of Governor Edwards. And as I believe Lisa was reviewing, this mask mandate applies to those who are 5 years of age and older when they're indoors. LDH also made one additional change to the recommendations. We did say that everyone needs to test after they've been exposed, and not just unvaccinated individuals. Of course, anyone who tests positive needs to isolate immediately. And if they're negative, we ask that they get tested again, maybe 5 days or so later. We just want to capture any new infections among people who might have been exposed. And again, it's more important now because of what we know about fully vaccinated individuals being able to potentially transmit it, even if they have some kind of mild or asymptomatic infection. So those are really the main changes that we've made. Fully vaccinated individuals, they do not need to quarantine. We're still not recommending that they quarantine after exposure. And they don't need to quarantine between these two periods. If they test immediately after they find out they've been exposed, and then they get tested again 5 days later, there's no need to quarantine during that period of time either. So it's just testing to catch any potential cases, which again are much less likely to occur amongst people who are fully vaccinated, but no need to quarantine. So I think I've already covered a lot of this. Why is vaccination so important? Again, the vaccines are not 100% effective, but they are actually some of the best vaccines we have. And here's some information that can show you just how effective they are. If you look at the cases from this 1 week period in the middle of July, 90% of those new cases were among people who weren't fully vaccinated. So the vast majority of the infections, the new cases that were occurring, were among those who were unvaccinated. 85% of the COVID-associated deaths in that same period were among those not fully vaccinated. Again, most of the people who were fully vaccinated that died as a result of COVID had some other sort of predisposing condition. I can tell you that between 75 and 80% of those individuals are older than 70 years of age. 89%, so almost 90% of the patients hospitalized with COVID-19 on July 30th were among those not fully vaccinated. We track that on a daily basis, and that's pretty much what we're seeing over time. It's about 90% of the hospitalized patients with COVID are not fully vaccinated. And that really just shows you how well protected folks are. I know we're running out of time. I do just want to briefly mention that by and large, I know people are concerned about vaccine side effects. Overall, they're mild. You might have a local reaction at the site where you got your injection. You might have some fever, chills. Tiredness is one that people talk about a lot. A lot of people experience fatigue. I did after my second shot as well, but it really only lasted for me that actual day. There are some tips for how to reduce some of those symptoms that you might be experiencing. But I know a lot of people have questions about other more serious adverse effects. And what I can tell you is that we track that. We've asked all the clinicians throughout the state to report to us, we have a hotline, any sort of serious reaction that occurs as a result of the vaccine. And as of today, I believe we have over 2 million vaccinations that have been administered to Louisiana, and we only have 8 serious reactions that have occurred as a result of the vaccine. All of those people have fully recovered. And really most of them were reactions that you would see potentially to any vaccine. We do have a couple of the myocarditis reactions that were reported. Those were very mild. That's the inflammation of the lining of the heart that you might have heard about. Those were extremely mild. Everyone has fully recovered. And I like to highlight the fact that we have 8 of these reactions among more than 2 million doses of vaccine, and we have over 11,000 people in Louisiana that have died from COVID. So it's just to sort of give everybody a little bit of a perspective in terms of where the risk really lies. These are just some common myths and misconceptions. You might have heard some of these. I'm going to quickly go through them. There's a lot of question about whether or not the vaccines were developed too quickly. All of the actual safety steps were followed. These companies did get additional support from the federal government that helped them to recruit participants more quickly and helped sort of expedite the process, but it did not compromise any of the safety steps at all. It allowed them to manufacture the doses more quickly, and it allowed them to recruit participants in their trials more quickly, but they had to have the same large number of participants in the trial. Every other single safety step was followed, exactly as it is for any other vaccine. COVID-19 vaccines can change your DNA. That's just absolutely not true. And I think people hear the mRNA vaccine, about the mRNA vaccines, but these just contain material from the virus that really sort of prompts your body to respond to COVID-19 if you're exposed to it. Nothing to do with our own DNA. There is no live COVID in the vaccine. They can absolutely in no way give you COVID. Getting a COVID vaccine will cause you autism or cancer. There's been a lot of data that have reviewed any kind of link, especially to autism, but also to cancer for a lot of different vaccines. It has been completely refuted. It is completely unfounded. There's no link at all. You don't need a COVID vaccine if you've had COVID. That's also not true. We do recommend that you wait until you've recovered from COVID. But what we don't know, there is variability with regard to natural immunity, how well someone is protected against a future exposure just from their body's own immune response to an infection. We have better information, and we know people are better protected if they have the vaccine, even if they've had COVID before. So absolutely everyone, even those who have previously been infected with COVID, still need to get the vaccine. They cannot cause infertility, and Bill Gates has not planted microchips in the COVID-19 vaccine. I get a lot of questions about whether or not it's safe for people who are pregnant to get the vaccine. And what I can tell you is that there's absolutely no contraindication. I encourage people to talk to their obstetricians, but it's highly safe even for pregnant women. But I can tell you we have seen, unfortunately, some severe outcomes related to pregnant women who have been infected with COVID. So I certainly encourage anyone who is considering becoming pregnant or who is pregnant and is worried about getting the vaccine to talk to their obstetrician about it, because there really is risk related to being infected with COVID during that time. This is just a slide that shows the percentage of regions, and you can see here we have 1.7 million people who've completed their series. That's about 37% of our population. We really need to get that a lot higher to help stop this transmission. But this is the one piece of good news that I'm bringing today, and that is that our vaccinations are increasing. Unfortunately, we see a lot of the other indicators increasing related to transmission and hospitalizations and deaths. They're all going the same direction, but so are our vaccinations. More and more people are choosing to get vaccinated. And here I'll just end on this slide that shows our vaccine hotline. The hours that people are available to answer calls are there. Any questions, there are medical professionals that are available if you have questions or concerns that you want to speak with a medical professional about. And also they can help you find where to get a vaccine. And I'll just end by saying that right now we are honestly in a real crisis mode in Louisiana. And that's why we need to take every possible measure to prevent COVID transmission that we can. Vaccines do take a little bit of time to work. They are going to be extremely important in the weeks and months to come to help stop this pandemic in Louisiana. Masking is what we need to do right now. Everyone indoors over the age of 2 in order to stop this current surge. So I'll leave it there. And I know we're sort of over time. I don't know Lisa, if you want me to answer questions that may come in later, or how would you like to do it, Lisa or Jenna?
Hi, Teresa, it's Jenna. We did have quite a few questions come in regarding quarantining periods. If you don't mind just walking through quarantining, I think that would help out some folks who are wondering.
Sure. So the quarantine period, the sort of gold standard quarantine period, the one that everybody used to use, is 14 days. That is the absolute safest amount of time. You know that if you have not developed symptoms, and especially, you know, if you test negative at the end of 14 days, there's no way that you are going to, at a later date, develop COVID from an exposure that you've had 14 days ago. So that's the gold standard. However, we do know that there are some shortened quarantine options that can offer a lot of protection. They really are safe to use. And there are two shortened quarantine options. One is using a 10-day time period alone. So if you quarantine essentially for 10 days after your last exposure to someone who is known or suspected to be infected, compared to 14 days, you shorten it by four days. Most of the people who are going to actually be infected after an exposure, it's going to be within that 10 days, right? So CDC has said, we think it's pretty safe. Most of the people, very few people, it does happen, but very few people are going to develop the infection and become positive between day 11 and day 14. So it is very safe, not as safe as 14 days, but still very safe to use that 10-day only shortened quarantine period. The other option is to use a 7-day quarantine period, but the 7-day quarantine period, because it's shorter, requires a little bit of an extra step. You have to test negative. So you have to test negative between day 5 and day 7 after your exposure. And if you test negative on a viral test during that time, then you can be released after day 7 from quarantine. Now, all of these options, 7 days, 10 days, and 14 days, that all assumes that you have remained asymptomatic during your quarantine period. If someone develops symptoms, they need to immediately be tested at any point, and then they need to, if they're positive, they need to isolate. I will say this about early childhood settings. The shortened quarantine options require that people mask and distance as well throughout the duration of the 14-day period. So the 14-day quarantine period. So typically the shortened quarantine options are difficult to use in early childhood settings because people can't continue to mask, people who are exposed can't continue to mask and physically distance in those settings. That's sort of the question that, let me go to the chat. Were those what the questions were about?
Yes, thank you, Teresa. And thanks so much for being on with us today. We really appreciate you giving your time and all this really helpful information for everyone who's on the line today. Thank you again. We appreciate you so much.
Sure, happy to be here.
So just a few reminders to everyone. We have placed the updated COVID guidelines in the chat today. So the updated guidelines from OPH are located, linked there in the chat. Those are containing some fresh updates just from yesterday. So this is really very, very current and what everyone should be following at this point in time. So go ahead and access those in the chat. Just a few other reminders. We also had a few lingering questions come in around teacher support grants and the ARPA grant applications that we went over in today's webinar. So for those two items, just some clarification that the support grants, those applications closed back in July. So we brought them up again today because the funds will be dispersed at the end of next week, beginning the end of next week. And so we wanted to just bring everyone information today around the benefits cliff that we talked about. But that application for the teacher supports grant for this first initial round did close back in July. So today we were talking about the disbursement of those funds and how you all see fit to disperse those to your teachers. The other grant that we talked about today, Lisa went over, was the ARPA grant application that opened today. You should receive an email to apply for the ARPA application. If you do not receive an email to apply for the ARPA stabilization grant, you should notify our provider help desk immediately. That means that for some reason there was not a current updated email address for you on file. And so please notify the provider help desk immediately as soon as possible if you do not receive an email with the application for the ARPA stabilization grant that Lisa went over on today's call. That grant application opens today. It will close on August 19th. And again, those funds will be released throughout September by region. So just a little clarification on those two separate distinct grants with different funding sources for different purposes. Wanted to walk y'all through that today. Also received some questions in the chat that we were trying to answer directly throughout so that we didn't go too much over. But we did get a few questions about CPR and first aid requirements, some really specific questions based on individuals. So just a reminder to go ahead and contact licensing for any CPR and first aid requirement questions. So thank you all for joining us today. Once again, you know how to reach us. Within the slide deck is all the contact information for our various teams here at the Department of Education. Thank you all for joining today and have a wonderful rest of your day. And everyone, please stay safe.